So good afternoon. Today we're joined by Jody White, who's the CEO of Lawrence General Hospital. Thank you for being with us. And by Kate Walsh, who's the CEO of Boston Medical Center. Thank you for being with us to discuss the rising hospitalizations across the Commonwealth due to COVID-19. In a few minutes, they'll talk in more detail about what they're observing in their corners of the Commonwealth and how they're preparing to fight COVID. First, I want to give a quick update on the numbers. Yesterday, the Department of Public Health reported 1,184 new cases. The 7-day average positivity rate is 2.35%. Just over 47,000 new molecular tests were reported, and over 6.7 million tests have been administered to date. Back in March, we had the capacity to conduct about 2,000 tests a day. We're now conducting on average about 73,000 tests a day. And last week, we had our first day where we did over 100,000 tests. There are about 588 hospitalizations and 143 cases in the ICU. Like many other states and countries, we're seeing a rise in new COVID-19 cases and hospitalizations. Since Labor Day, cases have increased by over 300%, and in the same period of time, hospitalizations by nearly 200%. On Labor Day, the number of people hospitalized for COVID-19 was down to 178. Today, as I said earlier, that number's climbed up to 588 patients needing hospital level of care, and as I said before, 143 in the ICU. Statewide, the Commonwealth's hospital occupancy is up to 67%, and the ICU occupancy is at 50%. The trends obviously are going in the wrong direction and show no sign of changing. COVID-19 has now been with us for the better part of a year, and we've learned a lot about how to address this terrible virus. In addition to building a massive testing and tracing infrastructure, we've also executed on plans to better manage our healthcare systems during a pandemic. Our experience from last spring shows that creating enough space to safely treat COVID-19 patients and other patients throughout our healthcare system is the single most important aspect we have of navigating the pandemic as safely as possible. And being prepared for every scenario is critical. The COVID-19 command centers work side by side with our hospitals to plan for a surge, to expand capacity, and to set up alternative care sites. We hope we won't need to use many of those additional resources, but preparing our healthcare system now will help us keep schools open and our economy open and our healthcare system open as well. As everyone probably remembers, because of the surge in hospitalizations last spring, we had no choice but to restrict elective procedures and many other procedures, and some people didn't get more of the routine medical care that they should have had at that time. We're doing everything in our power to avoid that scenario happening again. With cases and hospitalizations on the rise, Massachusetts hospitals are preparing once again to meet the needs of COVID-19 patients. Together, our administration and Massachusetts' world-leading hospitals have been preparing to meet that demand while still providing medical care for non-COVID patients. As part of that effort, on an as-needed basis, hospitals are prepared to make an additional 400 beds available by converting acute care beds to ICU beds. Also, as part of this effort to build even more capacity, this administration will once again begin to plan to stand up field hospitals. We're in the process of working with MEMA and with hospital officials to identify suitable locations to locate and staff facilities. Where and when these facilities are stood up will depend in part on available space and where the needs are. These field hospitals will be fully equipped with hospital beds, life-saving equipment, and medical supplies, and they'll be staffed by hundreds of medical professionals to care for patients around the clock. We'll have more details about where we plan these facilities to stand up later this week. Converting unused space inside hospitals and standing up field hospitals will obviously add capacity, but our resources ultimately will be limited. In other parts of the world, and right now in some parts of the U.S., despite all the planning, medical facilities are being stretched. When it comes down to it, controlling this virus depends in many ways on the everyday actions of everybody. Our Commonwealth has done incredible work to fight this virus since March, but recently folks have let their guard down. That's evidenced by the spikes we've been seeing in positive cases statewide. We know folks are tired of this. COVID fatigue is probably a new word in the Urban Dictionary. But COVID is merciless, and it will continue to grow and spread whenever it's given the opportunity. And we're asking all of you to keep that in mind as we all fight it every day. Wear a mask, wash your hands, practice good hygiene, socially distance. Last week, as you know, we unveiled targeted measures to make sure everyone puts their guard back up. And we asked the public to observe the stay-at-home advisory that's in effect from 10 p.m. to 5 a.m. Observe the new gathering limits, particularly for private residences, and avoid hosting get-togethers at home, and wear a mask whenever possible. Get tested if you feel sick. There are free testing sites statewide that can turn around a test result in 2 days. Collectively, all of these actions will help us keep moving forward with our lives, and it allows us to keep our schools open so that our children can safely learn in person. It also helps keep our economy running so businesses can stay open and people can stay employed and keep working. And expanding our hospital capacity for COVID patients will ensure that our healthcare workers can take care of everybody's medical needs safely. Our administration and the hospital community are working to bring every resource available to continue providing non-COVID care like elective surgeries and routine medical services. But as I said, those resources are finite. We don't want to have to go back to the restrictions that we put in place last spring, and we need everybody's help to make sure that doesn't happen. As the Biden team transitions to the White House, it's encouraging to see the President-elect team focus on COVID on day one. I've said many times that the federal response to this pandemic has been inconsistent at times and insufficient at others. And I hope that a new administration can help remove the partisanship from this fight against the virus. Doing so is critical to keeping schools open for our kids and to keep the economy open and running. We've also received exciting news about the early results of Pfizer's phase 3 clinical trial for its COVID vaccine. Other companies are reportedly seeing promising results as well. This is obviously welcome news for our country and the world, and in some ways it's a relief to see progress like this, which can and will play a major role in ultimately bringing this pandemic to an end. We formed a vaccine advisory group a few months ago, and that group developed a vaccine delivery plan which has been submitted to the federal government. When the time comes, Massachusetts will be ready to distribute a vaccine. But we still have a long way to go. Until then, everyone needs to remember that we're still living with the virus for at least the next few months. The best defense against this insidious disease comes down to personal responsibility, and we all have a role to play to stop the spread. Before I turn this over to Secretary Sutters, I just want to say one more thing about the election. I'm dismayed to hear the baseless claims coming from the President, from his team, and from many other elected Republican officials in Washington. I've been a Republican for 40 years. I've raised money for Republican candidates. I've knocked doors for Republican candidates. I've answered and made phone calls for Republican candidates. But this latest move to employ the Department of Justice in all of this is so wildly inappropriate. And stalling an orderly transition process, especially at a time like this, is equally unacceptable. I can't think of a worse time to stall a transition than amid a deadly pandemic that the federal government continues to own primary responsibility for responding to. The Trump campaign has legitimate legal challenges. They should bring them to court, and the court should deal with those as quickly and as fairly as possible. But I'm aware of no legitimate claims of wrongdoing anywhere near the scale it would take to affect this outcome, and there's no credible third-party entity that's verified the President's claims in any way. Continuing to make these claims erodes trust in the system when in fact the election system is working exactly as it was designed to do. And let's not forget, there are Republican elected officials with major roles to play in the vote counting process in many of the states that are in dispute. Anybody who doubts that should take a look at some of Brad Raffensperger's comments, who's the current Republican Secretary of State in Georgia, about whether or not he thinks the process there was above board, proper, and appropriate. Orderly transitions of power are good for the country. They're good for the American people. There's simply no question on this. In every campaign season, we hear a lot about doing what's best for the country. And what this president is doing at this point in time is not in the best interest of this country. The administration needs to move forward and cooperate with the president-elect's transition team immediately. With that, I'll turn it over to Mary Lou.
Governor, Lieutenant Governor, Jody, and Kate, thank you for joining us today. Good afternoon. We are joined today, as you heard, with Jody White, who is the CEO of Circle Health and of Lowell General Hospital. He's also the chair of the board of the Massachusetts Health and Hospital Association, and Kate Walsh, who's president and CEO of Boston Medical Center, one of our premier safety net hospitals. Since day one, we've been working continuously to stop the spread of COVID while simultaneously strengthening our response capability and capacity. This includes diagnostic and surveillance testing, extensive contact tracing, community awareness focused on mitigating the spread in high-risk cities and towns, and hospital readiness initiatives. While case counts are rising, it is important to know that the Commonwealth is prepared and positioned to respond. Let me share with you some updates on critical functions. As Governor Baker has indicated, hospital readiness and healthcare capacity are critical components in our fight against COVID. This is especially true now, as we see an increase in daily case rates and hospitalizations. Hospitalizations of confirmed COVID cases have doubled over the last 5 weeks, from 288 on October 5th to 588 as of yesterday. Confirmed COVID patients in the ICU has tripled over the same period, up to 143 from 49. Currently, our ICUs are at 50% occupancy across the state. Hospital occupancy has remained between, overall hospital occupancy has remained between 65% and 70% throughout October and November, as hospitals remain flexible and open in their ability to handle patients. To be clear, our hospitals are open to serve all of the acute medical needs of our residents. At our peak of COVID hospitalizations in the 3rd week of April, we had less than 3,500 patients admitted to the hospital for something other than COVID, as far fewer people sought or delayed care. Today, our hospitals are treating 7,000 non-COVID patients statewide. Our advanced planning, our collaborative planning with the Hospital Association, our testing capacity, PPE supplies, and improved care regimen has enabled us to maintain capacity to treat an influx of COVID cases while keeping the doors open for all other patients. As the Governor has mentioned, we are working diligently to plan the stand-up field hospitals to help mitigate the stress on our hospital system as cases rise this winter. We have the capacity to provide over 1,900 ICU beds, plus an additional 400 ICU beds. Additionally, we have added 30 specialty beds at 2 long-term care facilities to increase capacity for individuals being discharged from acute care hospitals to nursing home level of care and who are on ventilators or had tracheotomies. It was an issue that had been identified last spring. On the surveillance front, our testing, resource monitoring, and contact tracing contribute to the Commonwealth data and public reporting. Some of it's the most robust, transparent, and detailed compared to other states. Since the addition of municipal level data reporting and monitoring, critical resources have been deployed to stop the spread. As of today, this has included inspections of more than 8,000 businesses by the ABCC and DPL to ensure compliance with masking up, social distancing, and gathering sizes. The Alcoholic Beverages Control Commission, since August 11th, has, as I've said, they've engaged, they have investigated more than 8,962 open locations. An estimated 97% are in compliance with all the rules and guidances. 2% were issued written or verbal warnings, and 98 were charged with operating in violation of the executive orders. They are doing their part. The Division of Professional Licensure, since September, has completed 976 inspections and found 237 violations. And the Department of Labor Standards has opened just over 1,200 cases. As we continue the work of preparing for and tackling the expected rise in cases this winter, the COVID Command Center will continue to be in constant contact with hospitals to ensure they have the support and resources they need to serve the residents of the Commonwealth. We are prepared together. We continue to plan the appropriate strategies to meet any increased demand in care. Thank you. With that, it's my privilege to turn it over to Jody White.
Secretary Sudders, thank you. Governor Baker, thank you. Lieutenant Governor Polito, thank you for the great work that you're doing. Your entire administration is truly standing with us and saving lives as we move through this pandemic. As mentioned, my name is Jody White. I'm the President and CEO of Lowell General Hospital and Circle Health. I am also the Executive Vice President of our system, WellForce, and I am the Chair of the Massachusetts Health and Hospital Association Board of Trustees, representing over 100 members across the Commonwealth, your healthcare system. It's no secret that our communities have seen an increase in COVID cases since Labor Day, and that is now leading to an increase in hospitalizations and rising fears across the Commonwealth of what a possible surge might look like. On behalf of MHA, my fellow healthcare leaders in the Commonwealth, I want to give the residents of Massachusetts a sense of confidence. Confidence that our hospitals and our healthcare organizations across the Commonwealth are safe and are prepared. You are safe with us. Now, we don't know precisely what the second wave of COVID might look like, but we are in a much stronger position to respond because of the many lessons learned from the unprecedented challenges that we faced earlier this year. In March at Lowell General Hospital, we admitted our first COVID-19 patient. Within 5 weeks, we had more than 100 patients in the hospital, many of them critically ill and on ventilators. In response, we followed the governor's guidance and the guidance out of the COVID Command Center, and we temporarily halted all non-urgent activities to do three things: preserve our PPE, preserve our staff, and prepare for pandemic patients. At Lowell General, we expanded our critical care capacity from 2 ICUs to 5, and in partnership with the University of Massachusetts at Lowell, Chancellor Jackie Maloney, and with the city manager in Lowell, City Manager Eileen Donahue, we created a 90-bed field hospital at the university's gymnasium. Thankfully, we didn't need to use it, but we were prepared. Hospitals and healthcare systems across the state have risen to the occasion and provided similar levels of appropriate readiness as the pandemic continues on. Collectively, we've managed this unprecedented public health crisis through the heroic commitment, and I want to say that again, the heroic commitment of our providers, our physicians, our nurses, our housekeepers, our frontline staff, coupled with unprecedented levels of partnership and collaboration across the state. In times of crisis, leadership and partnership begins at the top. With Governor Baker's leadership, with Secretary Sutter's drive and execution, we all came together to focus on putting patients first, saving lives, and protecting our caregivers, and the results have been nothing short of remarkable. Our hospitals were never overwhelmed during the initial COVID wave, and that was not by chance. It was a direct result of the work led by the Governor Baker administration, partnering with MHA and our healthcare providers across the Commonwealth. But it was also because you, our neighbors, the general public, stepped in and made sacrifices to help us cope with the COVID crisis. Our communities embraced prevention measures. This caused a decline in the virus during the summer, giving us time to assess our response to the first wave, and more importantly, giving us time to learn and prepare for the next one. We used the time to gather additional equipment, medications, supplies, develop new protocols and practices to enhance the care for patients and to keep our caregivers safe. At the bedside, our providers have innovated like never before, creating new best practices to treat patients for now and for the long run, well beyond the time when this pandemic is with us. And we all collectively look forward with great anticipation to the arrival of an effective vaccine in the coming months. Nice virus. Until then, the residents of Massachusetts need to stand with us and continue your efforts to stop the spread of this very, very dangerous virus. My message is this: we are all in this together. Here's your role. You must wear your masks. Social distancing must continue and gatherings must be kept to a minimum, very difficult to do during the holiday season. Washing and sanitizing your hands at every opportunity, and of course, protecting the most vulnerable that are with us. And please, get a flu shot. Prevent additional burden on our communities, and above all, prevent additional burden on our health systems that translates into big problems if flu spreads. So please get a flu shot. These small actions translate into large results. They do two things. They keep our communities safe, but for the purposes of this talk, they keep our healthcare system strong for you. And an important message to our patients, and the governor mentioned this: please don't delay care. Remain engaged with your doctors and your healthcare teams. We are well equipped to meet your needs, whether it be in person or remotely or by telehealth. We are here for you. You are safe with us. In closing, I want to personally thank the governor, the lieutenant governor, and Secretary Sutters and their teams for the overwhelming support that has been offered to healthcare over these last 9 months. They have been with us every step of the way, phone calls every week, common communications, putting patients first, and being an outstanding partner in helping us to save lives across the Commonwealth and take care of our caregivers. Our healthcare professionals, thank you for your support. We are prepared, you are safe with us, and we are in this together. Thank you. Kate.
Thank you, Jody, Governor Baker, Lieutenant Governor Polito, and Secretary Sutters. On behalf of all of my colleagues at Boston Medical Center and the patients we serve, I want to thank you for your ongoing efforts to combat this pandemic. We are all very happy that we live in Massachusetts. Your leadership, focus, some would say relentless focus, on ensuring we have the resources, information, and tools to respond to this pandemic have been critical to our ability to care for those in need. I also want to thank Jody, my friend and chair of the Mass Hospital Association, and hospital leaders across our Commonwealth who have been invaluable partners over the past several months. I know there are concerns about increased hospitalizations, but we are prepared. We're prepared for increased COVID patients, and we remain confident that we will not see the numbers that we saw during the first surge, where at Boston Medical Center we treated over 1,400 patients. While the rising cases that we are seeing in our state causes apprehension, we know we cannot underestimate this virus. The Massachusetts hospital community is in a very different position today than we were last spring. We are well prepared for a second surge. It'll be much less disruptive to our operations. And there are several reasons why we're more confident. As Jody noted, the partnership between hospitals, the state, in coordination with the Baker administration, have allowed us an ongoing dialogue to share lessons about how to care for COVID patients, from novel treatment protocols to how to quickly and effectively reimagine our hospitals to meet an increase in patients. Testing capabilities and turnaround time has vastly improved, and there's much deeper coordination and sharing of information at the city and state level on all our testing data. We have all built better predictive models, and we have a number of early warning systems in place. Another key difference is that we have sufficient personal protective equipment on hand. Last spring at Boston Medical Center, we were counting PPE in days. We're counting in months, and we have a year's supply of hard-to-acquire items. We have also established infection control policies and protocols, and they are firmly in place to keep our patients and our staff safe. In recent days, there's been really promising news about vaccines and new medicines and therapeutics on the horizon.
Boston Medical Center is proud to be a site of the Pfizer vaccine trial, and I applaud all of the clinicians and researchers in our state and around the world who are working literally around the clock to develop a safe vaccine as part of a global response to this pandemic. I know that through the state's vaccine task force, those communities who have been disproportionately impacted by COVID, including essential workers and those who live in multi-generational housing, will be prioritized as vaccines and other therapeutics become more readily available. Our job as healthcare providers is to be ready for anyone in need. We know that cancer, heart disease, and injuries do not stop during a pandemic, and we feel confident in the coming weeks that we'll be able to safely care for an increase in COVID patients, as well as our patients who are struggling with other illnesses. To do this, we rely, as Jody said, on the incredible work of our teams, who time and time again have demonstrated their expertise, their dedication, and their compassion. Our ask, and my ask as a hospital leader and your fellow citizen and a mom, is that we all do our part to stay safe. From the outset of this pandemic, the Baker administration quickly enacted public health measures to help curb the spread of COVID-19. Today, you're hard-pressed to pass a car on the road that doesn't have a mask on a dashboard or dangling from the rearview mirror. And it's become our habit to put our mask on and heading into your office or going to the grocery store. Back in March, we didn't have those protocols in place. And I want to echo what the governor, the secretary, Mayor Walsh have been consistently saying. And please urge all of us not to get complacent. Wear a mask, practice physical distancing, and hand hygiene. These public health measures work, and together we can save lives. Thank you.
Start with questions for either Jody or Kate. Seeing none.
Governor,
Got anything for me?
without a peaceful transition of power, what does that mean for vaccine distribution?
I think the vaccine distribution process is currently being managed between the states and the federal government, and is a process that is well underway. But I just think at this point in time, it's really important that the folks who are currently in the key roles in the federal government and in the administration when it comes to all issues associated with this pandemic be working and talking to the folks associated with the Biden transition team. Irrespective of whatever might happen in the courts, one or the other is going to have to continue to play this hand through the month of November, through the month of December, and through the month of January and beyond. And as we enter a period that everybody has acknowledged is going to be one of the toughest periods we've dealt with since the beginning of this outbreak last March, it's critically important that there be a focus in our nation's capital on this issue. I mean, people were talking before the election about the possibility of additional resources for testing and tracing and some of the other key elements that states and providers are doing under the current set of circumstances to manage the current increase in cases. Right now, there's no talk about any of that going on in Washington. And you just add it all up, and what it translates to me is a period of time where we are at a very critical moment with respect to this nation's response to this virus, and there isn't guidance, direction, or a consistent message coming from D.C., and that's a problem.
So the president should just accept the results of the election?
I think it's important for people to continue to work this issue and work it hard. And right now, that's not happening.
Governor, what would you say about the distribution plan for vaccines? How it will be in your hands. How can we be sure that people that really need these vaccines, assuming there's a limited amount initially, are getting them? And which groups would you prioritize?
Why don't you speak to what the plan actually has to say and how it was framed relative to the federal instructions?
So at this point, it's our understanding from the federal government that states, in fact, governors and their departments of public health will be able to establish what the priorities are. So we have both an internal group, as you know, and an external group who's advising us. And in terms of the allocation, we have advocated that the allocation of vaccines should be on a straight state per capita basis, and have not heard, it goes back to what the governor said, there's been like no communication since the election about what are the next steps in vaccines. So our internal group continues to meet with the external advisory group on establishing what priorities would be, depending on what the allocation is. And it's posted, so everyone can see what the plan is for the Commonwealth at this time. But it's a general plan. The good news in Massachusetts is we distribute millions of vaccines every year, and we have a strong, strong vaccine infrastructure of which we are building upon it. So that's the good news. And what we need to have from the federal government is the safe and effective vaccines that are approved, know what the research is that's behind the vaccine, so everyone is confident that they're safe and effective, and then we're really prepared to then allocate them based on the priorities that we set.
Would elder care facilities be at the top of the list and hospitals?
Healthcare providers are definitely at the top of the list. Obviously, those individuals who are older with compromised immune systems, and certainly older adults in long-term care are part of the priority groups. It really depends on the allocation that we get from the federal government.
Governor, have you put a PS on that, which is one of the other issues that's currently sort of in process, and we're kind of waiting to see where it goes, is what the actual delivery mechanism for vaccines would be. And the reason I bring that up as an important issue is to respond to your question about long-term care, Jonathan. You know, there's a variety of ways that you could choose to distribute a vaccine. And some of them would involve ways that would make it easier to provide vaccines to people in long-term care facilities who really, in many cases, aren't in a position to go get one the way most of us in this room could just go to a CVS or go to a Walgreens and get one, or go to a provider and get one. That's another example of an issue where I think people would like to get a little clarity as soon as possible about how they're thinking about what the distribution model is going to look like based on the data they got from states, about how states would prioritize where they would go first with respect to who would get it.
Governor, have you or anyone in the administration reached out to or been in touch with anyone from the Biden transition team so that the transition from Massachusetts with federal government might move smoothly?
I don't believe at this point, I haven't talked to them. You guys talk to anybody? Right, okay, so there are a bunch of Boston folks who are on the vaccine, on the COVID advisory group. Our office hasn't had any contact with anybody.
Governor, what about the fact that the vaccine has to be held at -80 degrees? Is that a concern? I would imagine CDF and things like that don't have freezers that go that low.
Do you want to speak to that one?
So it's obviously where you can store, have cold storage for -80 degrees is very important. It does come packed through McKesson in dry ice with 8 to 10 days, it's our understanding, of 8 to 10 days of dry ice accompanying it also. Many of our healthcare, our large hospital systems, have the capacity to keep it in cold storage. And then there's actually a number of days when it doesn't have to actually be in cold storage in order for you to administer it. And as the governor said, distributing it, particularly to long-term care facilities and the like, is a different kind of a model than going to like a healthcare institution for the vaccine. But it does come packed through McKesson in dry ice for about 8 to 10 days of dry ice comes with it.
Mr. Secretary, while you're here, sorry. What's the PPE situation in the long-term care facilities right now? We had seen a report from last year, PRG for the summer, that said that some of the stores were pretty low on the sort of supply in some cases. I think that was from August, so obviously it's November now.
Did you say PPE?
Now, yes.
PPE, I'm sorry. No, we do at the end of this, we're all going to do one pandemic pardon. You know what I mean?
Yeah.
So that was that was a troubling report for many reasons, because we have been monitoring PPE with our long-term care facilities for it's like a daily, if not a weekly event, and the stockpile is available to bridge. And that report, so nursing homes report directly to the federal government, And of the 36 that reported that they had PPE shortages, 27 of them belonged to one company, and they believed that they needed to make a statement that while they did not have, they had shortages based on conventional standards, but not based on conservation standards, and they felt they needed to make a point to the federal government. So they reported that they had a shortage. Of the 36, 4 have PPE shortages, and the other 2 belong to large chains. One did not report correctly, and the other one felt that they needed to make a point about conservation versus conventional PPE shortages. The Department of Public Health reached out to all of the facilities because they all attest to us that they have sufficient levels of PPE, and it's part of our ongoing monitoring of them.
And we do have a ton of PPE. We have a ton.
Would you say we are in the midst of a second surge or a surge right now?
Yeah, we are in the midst of what was expected and anticipated by a lot of folks in the public health and epidemiological community last spring, which is that there would be an echo associated with this and it would land in the fall. It's not just here, it's across the United States. It's, in fact, it's across many of the Western democracies at this point in time. And I think, as both Jody and Kate said, we spent a lot of time this summer with our colleagues in the healthcare community and our colleagues in the long-term care community, putting a lot of sort of tools in place to make it possible for us to effectively work our way through this. The one thing I will say is the enhanced amount of testing that we're doing gives us far better insight into what's going on with respect to the growth and the movement of the virus generally than we had last spring. And the other thing I would say is that if you just track the way, and I think Jody spoke to this, the hospital trends, which last spring moved basically at exactly the same rate as the trends associated with the case growth, the hospital trends at this point are running like 50% of the growth in the case growth, which is an important issue in terms of our ability to create capacity to offset the increase in bed requirements as we go forward.
Governor, just so I'm clear on the vaccine, and the fact that in Washington they are not talking about that right now. The longer this goes on with the election, are you concerned about a delay, about states receiving the vaccine, or this process getting gummed up because of this?
I think it's hard to, I mean, at this point in time, it's very hard for states to know or anticipate exactly what the game plan sort of week to week is going to be. I mean, I've said before at these events that I was on a call every week with other governors with the task force to work through many of the issues associated with managing COVID. And many of the healthcare folks were on calls with those people as well, and also on calls with folks in Congress with respect to what they were working on with respect to stimulus activity. Right now, that's not what Washington's focused on. And I think it's really important for Washington to focus on it, and I think it's really important for the administration to talk to the transition team. There's a COVID advisory group. It's got a lot of really smart people on it, and they need to be brought into that conversation so that whatever happens here, that nobody misses a beat.
Governor, how do you feel about releasing inmates who have COVID? Congresswoman Presley, D.A. Rawlins sent you a letter regarding this and urging you to sort of greenlight that.
So since the beginning of the pandemic, I don't know the exact numbers, we can probably get them for you, but people we felt would be better served in the community have been moved to the community. The parole board has paroled hundreds of DOC inmates since last March. I'd say thousands because I think it's thousands, but I'm not sure. It's a very big number. But there was a process involved there ensuring that those folks could make it in the community, had places to go, and there was appropriate settings for them. They have continued to do that process since the beginning. The second thing I would say is that they've done a really good job of managing COVID from the beginning. Throughout the length of the pandemic, except for a few months this summer, and even then they might have outperformed Massachusetts overall on their positive test rate. They've done a terrific job of keeping prisoners and inmates separated, providing them with PPE, sanitization, all that sort of stuff, instructions and guidance about how to avoid spreading the virus, and the numbers have shown it. And when they had an outbreak at Norfolk, they moved aggressively to test everybody who was an inmate in the facility, everybody who worked in the facility, and if you weren't willing to get tested as somebody who worked in the facility, you didn't get to come back to the facility. They've done a good job with this stuff.
As cases have gone up, have there been any discussions of moving backwards in phases or shutting things down?
Well, obviously, there are a number of communities that are currently operating in phase one, step one of phase three, and there are also a number of sort of standing orders that are in place that we issued recently with respect to the stay-at-home advisory between 10 a.m. and 5 a.m. and the reduction in the gathering order. We've also, on occasion, when we've come across particular incidents or circumstances like youth hockey, where we shut them down for basically 2 weeks to go through a process of getting some commitments out of them about how they would operate going forward, so that if there were outbreaks, we'd be able to use our contact tracing folks to pursue them. But as Mary Lou said in her remarks, the ABCC, which worries a lot about liquor establishments, restaurants, places like that, has done almost 9,000 inspections at this point, and only in a very small number of circumstances came across people who weren't complying with those rules.
Governor,
You were talking in your earlier remarks about concerns about the transition. It seemed to me like you were talking about you knock on doors for Republicans, you work for Republicans, all these things about Republicans. And I thought you were going to say, I'm ashamed about this or something about it, then you went off in a different direction. Were you headed in that direction, or what were you about to say?
I said what I meant. So.
Sort of a non sequitur?
I think it's ridiculous for somebody to make this argument that if you think the results of an election appear to be legitimate, and there are Republicans all over the country who actually managed those results, that you would come out and say that anybody who questions that is not really a Republican. I believe in many of the things that the Republican Party I support stands for, which is why I've been one for 40 years. One of the things I don't believe people should stand for, if you're any place in elective office, is this idea somehow that elections are only legit if you win. And more of what I hear coming out of this conversation implies to me that some of this is just raw double standard and nothing else. And when I think about the fact that, as I said in my remarks, the Secretary of State who managed the election in Georgia, who's disappointed that the president didn't win, and is upset and disappointed that both senators have runoffs, made absolutely clear in his remarks when he was criticized over the results that he ran a fair and free election in the state of Georgia. And that's the part that I find most disappointing.
Governor, does the Republican Party that you support still exist?
Of course. Look, I spend a lot of time with a lot of Republicans, both here in Massachusetts and in other parts of the country, and in Washington. And there are plenty of those folks who I admire and support and respect.
Governor, before you go, I don't know if you've heard the Celtics announced that Tommy Heinsohn has passed away.
Oh my God, really?
I'm sorry if I'm blindsiding you with that news, but is there anything?
Oh man, that is a shame.
I know you're
Look, first of all, I'm old enough to remember Tommy Heinsohn as a player, which means I knew the guy who was at least 50 to 100 pounds less heavy than the guy that most people know. He was a bear of a man as a grown-up and as an adult after he played. But what he really was as a player was just, I'm trying to think of who I would compare him to in today's basketball world. We don't really have power forwards anymore. But he was a dervish. I mean, the guy would get 20 points a night and 15 to 20 rebounds, and he would always cover the other team's best offensive player. And he was one of those guys who no one ever wanted to cover and no one ever wanted to play against, because he came at it with such a frantic intensity with respect to the way he played. And as a Celtic announcer, he was right up there with Johnny Most in terms of being so profoundly committed to the home team that if you were watching the game and listening to him at the same time, you would swear he was watching a different game than the one you were watching. Because every single call against anybody on the Celtics was a bad call, and every single missed call on the other folks was also a bad call. And I guess I'm really sorry to hear that, because he was such a special piece of our sports fabric here in Massachusetts. But the thing I would say most of all about Tommy Heinsohn is the guy was all heart. Whatever it was, whatever the cause, and he did tons and tons of charitable work. The guy was all heart, and I'm really sorry to hear that. I mean, 2020 has just been a crummy year all the way around, and there's one more great example of that. Thank you.
Can I ask you one question about the state GOP party leadership has been very pro-Trump message. Any of the candidates that they had that ran on that pro-Trump message didn't really crack even 35%. Do you think it's time for a change in messaging or even a change in leadership there?
Well, obviously, we spent a lot of time worrying about some of the folks who were running for the state legislature, and we came very close to winning some races that I was hoping we would win in the legislature. I was disappointed to see a couple of folks go down. But given what happened at the top of the ticket, I think the state legislative folks that we supported actually did pretty well, given the headwinds. But obviously, I think that going forward, to be successful in 2022, which is now what everybody's going to start thinking about, we need to recruit some candidates who can build a base of support in local communities, make the case that their presence in the legislature, which is where I really am focused, can be successful, and do the work and focus on the issues that people care about. And more often than not, the issues people care about when they vote for a state rep or a state senate candidate are different than the ones they talk about when we're in national election cycles. And I think it's important for people who run for statewide office to understand that what voters care about here are statewide or local issues, and that's really where our focus as a party needs to be.
Will you be on the ballot in 2022? Will you be on the ballot in 2022?
That's a long time away. I'm still trying to get over the loss of Tom Heinsohn.